All right. Hi, guys. My name is Kendall,
Hi guys, my name is Jasmine Moragi.
and this is our podcast titled Contagious Conversations. Today, we're going to be talking about diabetes mellitus. According to our MedSearch textbook, it is a chronic multi-system disease categorized by hyperglycemia from abnormal insulin production, impaired insulin use, or both. So I'm going to break this down because it's kind of a big definition. So it's a multi-system disease because it affects multiple systems. It's characterized by hyperglycemia, which is an increased level of glucose in the blood. It is from abnormal insulin production, so not enough or too much, or impaired insulin use, so if someone has it but they're not using their insulin, or both. So, and then the definition will depend on like what type of diabetes you have, and we'll get into the types. Some fun facts for you guys: around 10% of people have diabetes in the US, and that might seem like a small number, but it's actually equivalent to 34.2 million people, which is pretty insane. And it's also the 7th leading cause of death in the United States. So that's pretty sad. So today we're going to talk about, well, actually, before I get into that, there's 4 types. There's type 1, type 2, gestational diabetes, and then maturity onset diabetes of the young, or MODY. There's also some other like smaller, not lesser known types, but for the purposes of time, we're just going to talk about type 1 and type 2. I'm going to talk about type 1 and kind of get Jasmine's input on a couple things, and then she's going to talk about type 2. All right, so I'm going to get into type 1. Type 1 is diabetes is an autoimmune disorder where the body develops antibodies against insulin or the cells that make it. So we're going to explain the pathophysiology of this a little bit. So in a normal patient, well, first of all, let's talk about insulin. Insulin's a hormone produced by beta cells in the pancreas. It's released in small amounts to regulate the amount of glucose in the blood. So in a normal patient, a normal person that doesn't have diabetes, the amounts are released regularly, periodically, with no issues, and they regulate the glucose in the blood. When your blood glucose will increase after you eat, so your insulin will also increase to balance out the glucose. When your insulin drops due to no food, whether that's you don't have access to food and you just haven't eaten in a while, or regular fasting, which we all fast during the night, so your insulin will drop. The glucose that has been stored in the body from food you've eaten earlier in the day will be released. But the insulin must bind to receptor sites in insulin-dependent tissues, which means the glucose cannot be released to feed the cells unless the insulin is also kind of like a key that unlocks those receptor sites. So no insulin means the glucose can't enter the cells, and the cells will starve and die. And that's why people can decline so quickly with untreated diabetes. How do you know that you have diabetes? Usually through a blood test or a urine test, where the doctor will see if there's ketones in the blood. And then let's talk about some signs and symptoms while we're on the topic of signs and symptoms. So once the pancreas stops producing insulin, the patient usually presents with ketoacidosis, and if untreated, they can develop diabetes-associated ketoacidosis. And Jasmine, do you want to explain that topic a little bit more?
Yeah, so diabetic ketoacidosis, people call it DKA for short. It's basically, it's a life-threatening complication that occurs in patients, most commonly type 1 patients. Basically what happens is patients may not be taking enough insulin, or they could get sick. Anxiety and stress can also help trigger a DKA exacerbation, and this causes really high blood sugar levels in the blood. This can cause symptoms such as nausea, vomiting, abdominal pain, and basically what's happening is, since there's such a high amount of blood glucose in the blood, insulin, our best friend, can't get to all of that sugar, and that's gonna cause our body to go into ketosis, which is basically when your body starts burning fats as fuels, so ketones. And this is not good because these fatty acids are building up into the blood, and this can lead to toxic side effects. And this is metabolic acidosis. We don't want our body being in an acidotic state. So, some signs and symptoms of this would be hyperglycemia, the metabolic acidosis. It's going to cause deficient fluid volume because one of the side effects is going to be nausea and vomiting, and also diarrhea. So you're going to be losing a lot of those vital electrolytes. People with this condition, you're going to notice that they may have higher values of potassium, I believe. I actually did a care plan on this, and when I looked at the lab values, a lot of them were very out of range. So that's definitely something that is going to be common in that condition. And this is life-threatening because if it's not treated, this can lead to death, can lead to coma, cerebral edema. So if you are a type 1 diabetic, you want to be very mindful of your body just so you can make sure this doesn't happen to you, because that is very scary.
Yeah, that was a great explanation. Thank you, Jasmine. So Jasmine was talking a lot about signs and symptoms of ketoacidosis as well as DKA. So while we're on that subject, some other things that could happen are sudden weight loss, especially in young children, polydipsia, which is a fancy word for excessive thirst, polyuria, which is excessive urination, or polyphagia, which is excessive hunger. So all of these things are onset pretty quickly, and they'll become very serious if not treated. Moving on to risk factors. So type 1 diabetes, it's kind of a mystery how people develop it. Some people say it's through genetics, although a lot of people who have parents that have type 1 diabetes don't actually have type 1 diabetes passed down to them. So sometimes it's genetics, sometimes it's not. And then also it's thought that environmental factors could increase your chances of getting it. If it's like something in the air or like a virus. Didn't go into a lot of detail in the sources that we looked up, but it seems to be kind of a mystery. So moving on to treatments, insulin therapy is going to be the treatment. It's called exogenous therapy, which is a fancy word for injection. The people who have type 1 diabetes can choose to have multiple daily injections or have an insulin pump. When you inject, your injection sites are going to be the arms, the stomach, the thighs, or the buttocks. The stomach does have the most fat, so it's a common injection site. Most people, we have a friend that has type 1 diabetes, she likes the stomach the best.
Yeah.
And when you're injecting, you're going to want to rotate injection sites. So people with type 1 will typically change up where they put their injection sites.
Just so the area doesn't kind of get used to getting poked in that area all the time.
Absolutely, and it can cause like irritation and stuff if you continue to poke right there. For some labs that you'd want to check, just the A1C and glucose levels are going to be the most important, and those are continuously monitored. Our technology's advanced a lot, so most people with type 1 diabetes have a glucose monitor that constantly is constantly just checking the insulin levels and glucose levels in the blood.
And they also have apps on people's phones these days.
Yeah, absolutely.
Which is amazing. The technology advancing.
Yeah, I think it's really cool actually how much there's advanced and people don't have to be so scared all the time.
Yeah,
I feel like
literally saves lives.
Yeah, there were a lot more hospitalizations in I feel like the earlier days of diabetes because people didn't know what to do. They just went to the hospital.
Yeah, for sure.
Dying.
For sure.
So I'm going to hand it on over to Jasmine, and she's going to teach you guys about type 2 diabetes, and we'll discuss.
Hi guys, I'm Jasmine. I'm going to be talking about type 2 diabetes today. So type 2 diabetes is a chronic disease that occurs when the body can't use insulin properly. This can lead to hyperglycemia. If you don't know what that is, that's just high blood sugar levels in the blood. Usually insulin, if it's working correctly, insulin's going to take that glucose back into the cells for energy. But with people with type 2 diabetes, what happens is, and this is the most common, it's about 90% of all diabetes cases is going to be type 2. What happens is that there's a defective insulin secretion by the pancreatic beta cells, which, as we know, as nursing students, not everyone may know this, but we know that the beta cells in the pancreas are what produce insulin. So, since this is defective, this inability of insulin, there's also the inability of insulin-sensitive tissues that respond to this insulin. So that's another thing that happens. So basically, the insulin wants to get to the glucose, and there's special receptor sites there, but they can't respond as effectively. And then, if it was normal, they'd be able to bind to it and cause an action, but that's not working here. So that prevents insulin from doing its job. So blood glucose levels are going to stay high. Basically, what in easier terms, it becomes resistance. The glucose becomes resistant to insulin, or too much glucose in the body makes it harder so that insulin can't respond to this high amount. So that's why some of the risk factors include poor eating, like unhealthy diet. So if you're eating a diet rich in carbohydrates and sugars, you're already going to be super high, and your body can't compensate for all of that, so it's not going to be able to respond to all of it.
Yeah, absolutely. And not to cut you off, but I just wanted to say, if you guys eat sweets all the time, don't freak out. Like, it's not gonna be you, but it's over time. This is a long period of time where you are constantly ingesting carbs, sugars. You're not eating fruits and vegetables. You're not eating things that are good for you. Of course, like, we encourage a moderate diet. I have dessert like every day, but like, just don't do it for years on end, the same things every day. And my family's from the South, so I'm definitely, a lot of my family does have diabetes, or they're pre-diabetic, so that type of food, those fried foods, those foods full of like trans fats, saturated fats, that's really what's going to get you there. But I just want to put a memo out. If you're eating sweets every day, don't worry, just don't overdo it.
Yeah, exactly. That's a great point to bring up. And there's also, that's not the only thing. Not exercising. It's really important that you get active and exercise. Also, smoking can increase your risk. And your weight. So obesity also puts you at a higher risk, and also age. If you're greater than 45 years old, you're also at a higher risk. And also, I wanted to also say, why is this important? Because we always hear about diabetes, but we don't hear about what it can lead to, and like the major complications, or how it can really affect someone's life. And so, diabetes type 2 can lead to organ damage and dysfunction, organ failure, particularly to the eyes, kidneys, hearts, and nerves. For the eyes, it can cause retinopathy, which is basically just like impairment in your eyes, so this can lead to blindness. And then for the heart, it can cause hypertension, which is high blood pressure, and then coronary heart disease, and then it can cause nerve damage, so this can cause neuropathy. This is something we'll hear about a lot, neuropathy in the feet of diabetic patients. They always say, if you're not a podiatrist, don't cut a diabetic's toenails, because if they bleed, they're at a higher risk for infection, because they can't feel pain. They have more numbness down there because poor blood circulation.
And they're at risk for bleeding out too if that bleed goes untreated. I actually did not know about the blindness. That's crazy.
Yeah.
I didn't know that you could go blind.
And so that's important. So if they need to get their toenails clipped and they have diabetes,
Don't touch them.
call the podiatrist.
Call the podiatrist.
You do not want to get in trouble, and you also don't want to hurt the patient. And so for testings, they're gonna want A1Cs. Basically what this is it's just a measure of the average blood sugar after 2 to 3 months, just to get an idea of how they're doing. And then for like medications or how you're gonna treat this, a lot of people, type 2, they will be told to, eat better, exercise more.
Yeah, like a fixed diet, like more of a stricter.
Yeah, and insulin, and blood glucose monitoring,
Right.
which is very similar to what she said. Oh, and I also wanted to go over some of the signs and symptoms of like hyperglycemia and hypoglycemia. For hyperglycemia, you can remember the 3 Ps, which is what we learn: polyphagia, polydipsia, polyuria. Polydipsia, you're eating a lot since the glucose is still stuck in your blood. It's not getting to the cells, and the cells need the energy and nutrients. So you're gonna feel more hungry,
Right.
and you're gonna be peeing more, which is polyuria, which is gonna lead you to polydipsia, which means you want to drink more,
Right.
because you're losing that when you pee.
Right.
Did you talk about hypoglycemia?
No, I talked about the 3 Ps.
Okay.
I don't think I talked about hypo.
And then for hypoglycemia, you're gonna see like cold and clammy skin. You can see blurred vision, increased thirst, sweating, confusion. So just, if you know anyone who has diabetes, it's always just mindful to know about the symptoms, just so you can prevent them from going into the diabetic crisis.
Yeah, that's good. That's good to know.
We have a friend who's a type 1 diabetic, and I'll keep like little candies in my purse just in case something goes on, something happens.
No, it's definitely good to know about your friends' allergies and symptoms and things. And even, one day you could be in public and someone could need help and people don't know what's going on. But if you know the signs and symptoms, you could help them. You could save their life.
Exactly.
I don't think either of us mentioned this, but the last thing I want to say is that both of these conditions are chronic. They are lifelong. So you can be born with type 1, you can develop it, but it's lifelong. Type 2 is developed through poor lifestyle choices, such as smoking, like Jasmine said, obesity, overeating, poor diet, those types of things. So, just be aware of that. Type 1 you can't really prevent, but type 2 you definitely can. And so if you don't already have type 1, you're definitely at risk for type 2. So just, maintain a healthy diet, do the things that we advised, and just keep on chugging along. I don't know. Thank you guys for listening.
Thank you for listening to us. Have a great day.
Bye, guys.
Bye.